So when someone comes in for their first appointment, walk them through the audience through the process of that. Like what do you actually do when someone comes to see you?
Sure, like any medical office, they're going to fill out an intake form, a medical history. So
Mhm.
we'll go through that. A lot of people ask about insurance coverage. We always tell them check with your provider. If acupuncture is covered, we help with the paperwork necessary to get reimbursement. So as far as the interview, we look at them in terms uh, from perspective of Chinese medicine. So that's doing the pulse diagnosis, which I just described. The tongue diagnosis, your tongue tells a lot about your internal environment. We go through their medical history, ask them about medications they're on, operations they've had, et cetera. And we get to know the individual, what their priority is. What are we going to take care of? Sometimes people come in with a multitude of problems at the same time. If we can first prioritize the number one problem, if we can do other things at the same time, we will. Sometimes we have to get the first condition, under control and eradicated, and then we'll move on other things. I kind of jokingly say this is one-stop shopping. So a lot of times the person might have, an ophthalmic and eye problem. They may have an orthopedic type problem, may have a female gynecological problem. So we'll work that in and see, sometimes the points overlap. Sometimes you're treating multiple conditions at the same time. So if we can do that, we do that too. So once we go through the diagnosis, we figure out what the treatment plan is. If the person has a chronic condition, it may need a series of visits. If it's acute, maybe a few visits just takes care of it. It all depends on basically three factors. How serious is the condition? How long have you had it for? What is the age of the patient? And I mean the chronological age, not necessarily, the constitution. Some elderly people are very strong constitution. Some young people aren't, so we work all that in and we'll figure out what I think. First, I'll figure out if we can help you. If I can't, I'll tell you. If we can, then we'll figure out what the treatment plan is going to be. So then they have the acupuncture treatment. That's all done the first day, consultation and treatment. And any visits thereafter is a lot briefer because you don't have to fill out the forms or have the interview. So that's basically it.
Very interesting, Bob. The insurance part of this, I'm sure people are interested in that. Do you know offhand if it's covered by Medicare or not? I don't know off the top of my head.
Now, that's an interesting thing because just in the last 6 months, I'd say, they're beginning to open up coverage for back pain for Medicare. When they first started, they said the acupuncturist, which is a standalone profession, has to be working with a medical doctor in order to be covered. Now, that's, of course, going to be challenged by the thousands of acupuncturists, which are individually licensed and independent from a medical setting, MD setting, okay? So that's work done right now. So many people who have Medicare will rely on an ancillary, a backup insurance plan that they have. So if that insurance, a backup plan covers it, or if their primary covers it, then we can go forward and the office manager can help them with the billing.
Gotcha. Okay. So, are there, if in your experience, is there really any risk associated with acupuncture in terms of getting
From
treatment?
a trained licensed practitioner, no.
Okay.
Okay. The Acupuncture Examining Board in New Jersey is part of the Board of Medical Examiners. So there is testing requirements. You can obtain a list of practitioners either from there or the New Jersey Acupuncture Association, which you can go to their website and they'll have a list of practitioners. So right away, you're eliminating risk because you're going to someone who's been educated and trained in it. They've been thoroughly tested. So, you don't want to go to, someone who claims they're doing acupuncture. I was on the board for years. I'm no longer on it right now. And sometimes there were physical therapists, chiropractors claiming they could do acupuncture. You really have to scrutinize that and find out if they are independently licensed in that. There are people who are underground claiming they may, know acupuncture. Even Asian, We see, when I was on the board, plenty of Asian people who were not really trained, who were holding themselves out, and people thought, oh, he's Chinese, he must know what he's doing. That's not necessarily the case. Through the years of examining individuals, believe me, don't take ethnicity as a qualification. It's training, it's experience.
Big time. What are some of the classic things that acupuncture really does help with in terms of pain and so forth?
I think when I first began, the most common problem I saw that helped people avoid surgery is back problems. You get everything. You have osteoarthritis in the spine, may have herniations of discs. You may have spinal stenosis to different degrees. There's a lot of back problems. In New Jersey right now, this time of the year, allergies. We see a lot of allergic patients. The best time to come basically really is the season before you normally get it. That way, when the season comes along, you're prepared for it. Most people don't know that, so they come in at the moment when they're in trouble. We see a lot of allergies. A lot of female problems. We have women for fertility, which is very common today. A lot of clinics in vitro are suggesting acupuncture because they have a higher success rate that goes along with the in vitro fertilization. So mostly, I'd say we see a lot of arthritis, a lot of musculoskeletal conditions. And another thing which has really taken hold, I'd say, in the last decade is digestive problems. There's so many people having digestive problems. People are gluten intolerant, et cetera, et cetera. And acupuncture, versus some medication. And there's Chinese herbs to help ameliorate that situation, to get it under control and to make people feel much better. So respiratory, you have a lot of respiratory patients. In children, you see a lot of childhood asthma, frequent colds, things of that nature. As people get older, emphysema, COPD, things of that nature. So all the systems of the body, nerve-related, people with Parkinson's, okay, people have had strokes, okay, to help, you can treat a person who's had a stroke the next day to help them come back with any paralysis or deficit that they may have. We're going to see a lot of post-COVID people. People who've had it, and they may have cognitive, issues after. People have lost their sense of taste or smell. They need to retrieve that. So really, the spectrum is very broad. It's a whole system of medicine that's can run side by side with Western medicine.
So like, to follow up on that, if someone has they want to be treated for acupuncture for various reasons. So use the allergies as an example. So someone could be going to an allergist, but also be going to acupuncture to supplement the treatment that one is giving and then what you give. Correct? Is that what you mean?
They can, and some do. The allergist usually works with the desensitization approach. So they'll give you some of the allergen and start out maybe with a skin test and then build up with lighter and then stronger doses in order for your body to be able to handle it. So if they're out in the world and exposed to that allergen, they won't react as strongly. However, if there's enough of that allergen, it'll even overwhelm the desensitization. Okay. Chinese medicine looks at it from a different way. Instead of trying to get used to specific allergens, and there's thousands of them, right?
Right.
What acupuncture does is it builds up the host. So you have a buffer that you're in with the world around you. So when you have that buffer against the environment, you're not worried about the 1,000 different things because the buffer takes care of all of them. So that's how we're working at. We're not working on trying to identify mold, dander, dog hair, cat, et cetera, et cetera. We're trying to enhance your overall qi, your defensive qi, called the wei qi, that buffer, so that you can move through life comfortably.
Got it. That makes a lot of sense. That makes a lot of sense. So if someone was going to come for an appointment, what would be some of the things that they would need to do preliminarily, other than before they come to see you? Would they need to come for knowing that they're going to come for an appointment? Would they come in on an empty stomach? What would be the protocol for somebody that comes to it, to get treated?
Okay. If they're outside the physical, which you just mentioned, I'll get to. If they have any paperwork, if they have medical history, they've had MRIs, X-ray, etc. If they can bring the radiology report, that'll enable me, it'll edify me and I'll know even more. Okay, so that's helpful. As far as showing up the first day, we don't want them to come on a very full or very empty stomach. People who have been fasting or something like that, acupuncture can be strong medicine, and you don't want them to get lightheaded. So if they have something to eat, that's a good idea. Plus, we treat everybody lying down, so we never have anybody faint lying down, but that's what you would do. A full stomach, all the blood and the chi is working on, it's gone to the gut. So
Right.
what we're trying to do is send it in other areas that your body needs it besides the gut. So yes, we want you to eat, but we don't want you to have, been a glutton before you came in for acupuncture training.
Right. No hamburgers and hot dogs before you come in. How about caffeine? Does caffeine have an effect on the treatment? They should not have caffeine before they come in?
I've never made that a stipulation, and I'm sure plenty of people have shown up, having just come from Starbucks or something like that. So that's not going to bother the situation. I mean, obviously, if they have a nervous condition and we're questioning about their dietary habits and we find on the pulse it's affected their pulse, then we're going to make recommendations about that.
And you give dietary recommendations to people too?
Yeah, well, there is acupuncture diet that I'll go over for pain patients. They may be eating or drinking things or doing things that'll aggravate their condition. I want to let them know that so they can eliminate it, so they'll get better quicker. And from general knowledge and experience with different individuals, I may have other suggestions as far as their dietary habits go.
You'd also want to see a list of their medications too. I don't think we actually said that specifically. Right. Okay.
Yeah, earlier on the intake, we do go through that.
Yeah, that's I could see how important that would be. So so Bob, if somebody wanted to contact you, what would be the best way to do that if they were interested in talking with you?
Right. If you Google Robert Lenahan, acupuncturist, I'll come up. That's Lenahan. Or if you look at acupuncture-practice.com, acupuncture-practice.com, you'll come up to my website too. I'm local in Point Pleasant. Our local phone number, 732-899-0951. You'll get office manager to talk to, or leave a voicemail and we'll get back to you. And that's the best way.